Hey everyone. So today we're going to be talking about diabetes. We're going to start off with type 1 and see how that's different from type 2 diabetes. Then we're going to talk about gestational diabetes, which you guys may not have heard about. And finally, we're going to review with some questions. So to start off, type 1 diabetes. So let's look first at the signs and symptoms that someone might have type 1 diabetes. Some objective signs that someone might have diabetes are unintentional weight loss, frequent urination, and excess glucose in the urine. And we're going to talk about why these are telltale signs of type 1 diabetes. Some symptoms which might be subjective to each specific patient. Either they can have no symptoms sometimes, but they can also have increased thirst, hunger, fatigue, blurred vision, and also even behavioral changes. The reason that they're separated into signs and symptoms is that signs are more definitive lab-based tests that you can do and perform in order to determine if someone has diabetes, whereas symptoms are often self-reported by the patient, and these can vary between patients. Most have no symptoms, but some people do experience some slight symptoms. So what's the cause of type 1 diabetes? Well, unfortunately, the exact cause of type 1 diabetes is unknown, but here are some theories. One is that the immune system attacks islet cells, and these islet cells are insulin-producing cells, which are located in the pancreas. The pancreas is that organ that's kind of close or underneath your liver, and it releases insulin. There also might be genetic causes to type 1 diabetes. They might involve the HLA-DQA1 gene, the HLA-DQB1 gene, or the HLA-DRB1 gene mutations. And this might cause a change in that it cannot regulate immune system correctly. So so the cause of type 1 diabetes, as mentioned, is when the immune system attacks certain insulin producing cells, and these genetics affect the immune system, not specifically insulin. There also might be environmental factors, which can happen due to certain enteroviruses, and these enteroviruses often cause common cold symptoms, but can lead to some other genetic changes inside the person's DNA. So in this diagram, you can see the location of some of these genes. As you can see, they're actually located quite close to one another if you take away the excess DNA. Now moving on. How do you test to determine if someone has a diagnosis of type 1 diabetes? Well, a telltale sign is very high blood sugar. This is around greater than 200 mg over DL, which is a concentration, or fasting over 126. There's also, if you can have high blood sugar, that's considered greater than 11.1 millimolar over liter. These are all different units of concentration, basically, and these are considered very high. So as you can see on the bottom down here, the fasting blood glucose for a normal person without diabetes is around 3.9 to 5.5 millimolar per liter, whereas in someone with type 1 diabetes, this is usually over 7. And following a meal, normal people without this condition is usually less than 11 millimolar per liter and greater than 11 in people with diabetes. The reason that they're different in fasting blood glucose versus after 2 hours after a meal, is because when you eat food, your body extracts glucose from that food, and that glucose gets circulated throughout your blood and your urine. In addition, there's a test that involves glycated hemoglobin, which is what you might hear as A1C. There are two separate tests, and if this is over 6.5% concentration, then this person likely has type 1 diabetes. There's also something called ketones that can be measured in the urine and the blood. And finally, autoantibodies, which are these islet cell antibodies, glutamic acid decarboxylase antibodies, and insulin antibodies, such as IA-2A. And finally, some treatments for people with type 1 diabetes. The first is someone might take excess insulin. As mentioned, the cause of type 1 diabetes is unknown, but its effect is that the immune system kills insulin-producing cells in the pancreas. So because of this, their bodies don't produce enough insulin, and therefore some people need to take additional insulin through a needle or syringe, through an insulin pump, or an insulin pen. The insulin pen is kind of similar to a small EpiPen. They also need to track their carbs and monitor blood sugar levels. They also need to eat healthy and exercise regularly. Of course, these are important things for anyone, even if they don't have diabetes, but it's especially important in people with diabetes so they can make sure that their blood sugar levels particularly don't get too high. And finally, unfortunately, there is no cure for type 1 diabetes, mainly because we don't know exactly what causes it yet, but there are ways to reduce your risk if you do have type 1 diabetes.
So now we're going to talk about type 2 diabetes, which is the most common type of diabetes. So first we have the signs and symptoms again. So the signs again are going to be the objective, like measurements, things you can, observe from the outside, and then symptoms are going to be like what the person is feeling. So the signs of type 2 diabetes would be frequent urination, unintended weight loss, sores, frequent infections, and that can be, bacteria or viruses. It's because you have this weakened immune system here. And darkened skin areas, such as in the armpits or neck area, and excess glucose in urine. And then some symptoms, which is what you'd be feeling, would be increased thirst, increased hunger, fatigue, and blurred vision. Although the first three there are the most common, and then blurred vision is a bit less common than the others. So some causes, or at least suspected causes of type 2 diabetes, and this isn't an all-extensive list either, would be the body is resisting insulin. And so when the body resists insulin, this protein isn't able to actually, keep glucose levels regulated anymore. So you're going to have glucose have higher concentrations in the blood than the level that they should have. And the problem here lies oftentimes in the pancreas, with the pancreas not being able to produce enough insulin. And so that goes into, so if you don't have the pancreas working correctly and it's not producing insulin correctly, then you're not going to have that insulin to regulate blood glucose sugar levels. And again, with this, the exact cause is unknown, and there are many causes that we don't know, or that we think we could know about, but haven't been proven yet. And then, but some factors, not causes. So these are things that often can go into you getting type 2 diabetes, is being overweight or obese, having a lot of inactivity, mutations in the genes TCF7L2, ABCC8, or CAPN10, and then some other environmental factors such as viruses like those enteroviruses can alter the genome or alter the ability for the pancreas to function correctly. So, cause beta cell damage, and so these beta cells in the pancreas aren't going to be able to produce insulin the way they should. And just something to keep in mind is that having unfavorable factors are not grounds for a diagnosis of type 2 diabetes. And if you are having signs and symptoms, then you should go for a diagnosis. But factors don't go into that at all. So some different tests for diagnosing type 2 diabetes would be looking at glycated hemoglobin levels or A1C levels. And here you're going to take two separate tests. And so with those two tests, they're going to be able to determine if you have, this greater than or equal to 6.5% concentration of glycated hemoglobin, or that A1C. And so you're going to have the random blood sugar test, and if you get greater than or equal to 200 milligrams per deciliter, which is equivalent to 11.1 millimoles per liter, that's going to be an indication that you have type 2 diabetes. And then with your fasting blood sugar test, which means that you have fasted for several hours before you took the test, so that now you don't have that extra glucose in your system from the food that you've eaten. Then if you have greater than or equal to 126 milligrams per deciliter, or 7 millimoles per liter, then that's going to be an indication that you do have type 2 diabetes. And again, you're going to take two tests with this. They want to make sure that this is accurate. And there are also, different ways to do this. So they can, the random blood sugar test, you're going to take that at random times. But the fasting blood sugar test, that's more tightly regulated. And then you have the oral glucose tolerance test, which is where you're going to drink a sugary drink. It's going to have the high concentration of glucose, and you're going to test your blood sugar levels periodically over the next 2 hours. And if more than one of those comes out, or I think it's actually 3 or more, comes out as greater than or equal to 200 milligrams per deciliter of glucose in your blood, then that's going to be an indication that you, or that's going to confirm your diagnosis of having type 2 diabetes. So some treatments, again, there's no cure for this, but there are ways for you to sort of get yourself to the point where you don't need to be on treatment methods. Some different treatments would be weight loss. Of course, that has to be regulated by a doctor, and don't try to do that yourself. Healthy eating habits, healthy exercise habits, controlling what you eat and how you exercise, so that you're not exercising too much, and you're not getting enough glucose, and that you're eating things that don't have too high of a concentration of glucose, so that you have problems regulating your blood sugar levels there. And those are what a lot of people can use, and a lot of times people end up not needing that treatment anymore, so they can go back to their normal lifestyle, but they're more at risk for having blood sugar problems in the future, and it never really goes away. And then you can have medication or insulin, which is sometimes needed, but it's not always needed. And so there's different medications, which you can see in this chart over here. And I'm not gonna go over all of them, but you can use one of those at a time, or you can use several of them at a time. It all depends on what your doctor prescribes to you. And there are so many different ones, so that for your specific type of or the specific cause of why you have type 2 diabetes, because if it's related to a mutation or outside factors, or if you would have an allergy to a medicine, it's important to have these other types of medicine other than just like one specific type. And insulin is usually the last thing you do. So medication with other drugs comes first, and then if that isn't enough, then you would go to insulin. And you can have like insulin pumps, or just take that through like a syringe or needle. And then you're going to be monitoring your blood sugar like regularly. And this isn't actually a treatment, but it just helps regulate other treatments. So if you start to realize that your blood sugar level is way above what it should be, then you would want to like talk to your doctor about changing medications, or what you're doing with your eating or exercise habits. And same thing, if your blood sugar level is too low, then you'd want to maybe back off on your medication or insulin.
Hello. Next we're going to go over the gestational diabetes. And there's different signs and symptoms for gestational diabetes. And a couple of the signs are frequent urination. You're urinating a lot. A yeast infection, and excess glucose in the urine that you're taking. So in the old days, they used to test that by tasting your urine. Now they can just read it. But it's pretty funny to think about it that way. And some symptoms include that increased hunger, increased thirst, and fatigue. But as you can kind of tell, those aren't very specific when it comes to symptoms. So it can be hard to detect gestational diabetes compared to the type 1 and type 2, which had more clear symptoms. This is a little bit more sublime. It doesn't have as many factors that really show that you have it. Really the signs are the ones that really help show that you actually have gestational diabetes. It's not really the symptoms per se. So for example, if you go to the doctor and tell them you're constantly hungry and constantly thirsty and constantly fatigued, there's a number of different conditions or diseases that you could have, or infections that you could have, and gestational diabetes being among them. But the signs are a lot more clear-cut when it comes to diagnosing you. So let's look at the different causes of gestational diabetes. And it's suspected to be caused by the imbalance of hormones during pregnancy, but the exact cause is unknown, so this is all speculations. And risk factors include obesity, inactivity, previous diabetes / gestational diabetes, polycystic ovarian syndrome, and there's a lot of other factors as well. So as you can see here, this diagram kind of shows a lot of different factors that can go into how you can possibly get gestational diabetes. And as you can see here, we have age over 45. Older people are more susceptible to it. People with family histories, of course, it's partly genetic, so you can often get gestational diabetes that way. If you have had gestational diabetes in the past, obviously you're more likely to get it in the future. And then Asian and Middle Eastern ethnicities are more likely to get it, and experience excessive weight gain during pregnancy. The mother, you can get gestational diabetes, or if you're overweight or obese. So tests used for diagnosis is a glucose challenge test. And you drink a glucose solution, and after an hour you measure the blood glucose level to see how much you have digested. And if it's greater than 190 milligrams per deciliter, or it's 10.6 moles per liter, then you probably have gestational diabetes. And then they do a follow-up glucose tolerance test, and it's the same test that we want to see greater glucose content, and the test blood sugar content every 2 to 3 hours. And if 2 tests are out of normal range, gestational diabetes is diagnosed. So you need at least 2 of them, because within those periods of time. But if there's more than 2 or 2 and above, then you will be diagnosed. All right, let's look at possible treatments for gestational diabetes. So gestational diabetes, obviously, you would have to control your diet and control your exercise. And while that's important for normal people, as we said in the past, it's especially important for people with gestational diabetes. And then there's also prescribed medication for those with gestational diabetes. And insulin is very, very rarely used. Yeah, and then we can wait until after pregnancy is over with diet and exercise plan to get rid of gestational diabetes, because after the birth of the child, it often goes to normal. And as you can see here, this is like a sample management decision path on how that you would normally go about treating gestational diabetes. Obviously, you would attempt to at first diet and exercise to get rid of it. And if that didn't work, we would go to more medication and combination therapy from that, and then eventually insulin. But that insulin, once again, is fairly rarely used. It's not used nearly as often. Okay, I'm gonna hand it off for review.
Yep. Okay. So we're just going to review the questions. Yeah. Next slide. What are the 3 most common types of diabetes? Answer is type 1, type 2, and gestational diabetes. Which of these types of diabetes is the most common? Answer is type 2 diabetes. What are the most common symptoms of type 2 diabetes? The answer is increased thirst, increased hunger, fatigue, and blurred vision, which is the least common symptom. Bonus. What percentage of women who have gone through pregnancy got gestational diabetes in the US? The answer is 69%. 6 to 9%. Yep. Thank you. Thanks for your time.
Thank you everybody for watching, and if you have any questions, please feel free to email us at info@helyxscience.org. And thank you all for tuning in. We'll see you next week.